This is Lost or Found, the show where we think about how we can live healthier, happier, and more fulfilled lives. Here's your host, Dr. Michelle Choi. Hello, Dr. Nicole Harkin. Thank you so much for being here and welcome to Lost or Found.
Thank you so much for having me. I'm really excited for this conversation.
Oh, I am too. And before we begin, can you tell us about yourself?
Sure. My name is, as you said, Dr. Nicole Harkin. I am a board certified cardiologist, as well as a board certified clinical lipidologist, which is a doctor that helps people with cholesterol disorders. I finished fellowship about 5 years ago. So I'm about 5 years out of training. I did all of my training on the East Coast and was in private practice for a number of years out there as well. I recently relocated with my family to San Francisco, actually, over the summer in the middle of the pandemic. I don't recommend it. So I am now a resident of San Francisco, California, and I'm loving it. Um, During that phase, decided to open my own preventive telecardiology practice. So I'm actually seeing patients over telemedicine in California, New York, and in Florida, helping them prevent and treat heart disease. And I absolutely love it.
Wonderful, because I think that's exactly what we need in this world.
It is. I love prevention. It's a really, it's a definitely an under-recognized and sort of poo-pooed upon. It's not as quite as exciting, if you will, as interventional cardiology, where you put stents in and all of this other stuff. But it is the backbone of cardiology, and it is vitally important. And it's increasingly being recognized as really a subspecialty in and of itself, and something that needs to be focused on and prioritized for sure.
Totally. I mean, I think you bring up a really great point, prevention. Can I ask you, do you feel the way in which medical care is practiced in the US, are we doing enough to prevent heart disease?
That is a great question. I mean, I think the answer is in the numbers, which would say no, because clearly it is still the number one cause of death in both men and women across the globe and in the United States. So, despite all of our fancy medications, which are life saving, I mean, we have incredible medications that do wonderful things, but despite all of this, we still really haven't budged those numbers significantly in some time. And in some segments of our population, there's actually increases in risk of death from heart disease lately. So I would say no, and I think that that's obviously very complex and multifactorial, but it has a lot to do with how the medical care system is set up. And I'm sure we can get into that as well. It has a lot of limitations, which both you and I are well aware of, unfortunately. And then just in terms of our priorities as a society, in terms of what foods get subsidized, we've got a lot of processed foods and things like that. So there's a lot of public health things that need to be done, and then also things within the medical care system that need to be done to prioritize prevention as opposed to treatment once we're sick.
Totally, because I think it's amazing that there's so many medications out there, life-saving procedures, but I think quality of life is really correlated with prevention, like not getting sick.
Exactly. And so it's not enough to, we don't want to just prolong life. So, say, I mean, yes, that's important as well, but we want to prolong quality, good life, right? And so I think, and that's a great point as well. We don't always recognize the fact that there's this whole large group of people who suffer devastating heart attacks and devastating strokes. And while they might not pass away from them, which is good, they have long lasting consequences, and the remainder of their life is not at the quality at which they would like to live it. And so that is equally as important as well to prevent.
Yeah, and I think having been a primary care doctor, I think the real truth is that, medical care is not really focused on prevention. Like in a short 15-minute visit, which is really 7 minutes, you treat hypertension when it happens. You don't prevent it. You know,
Absolutely.
so much could be more accomplished if we address it, but unfortunately, with the way medicine is structured, there's really no time to really have a discussion to go into like the crux of it, which I think is lifestyle.
Absolutely. It's really, really challenging. And many, it's frustrating for both medical providers as well as patients alike. And so, just how, the ownership of who's in charge right now, it's not the doctor and it's not the patient. And it should be those two people that are in charge of the medical care. And instead, it's other people with vastly different interests in mind. And so, you're exactly right. Specialists and primary care physicians have 10 minutes, which is actually just a couple of minutes once you take into consideration the vitals from the MA and all this, and the med rec checking and all these other click boxes we have to do. Then it's only a couple minutes left for really, talking with your patient about what's going on. And that's not nearly enough time to get into just even simple, basic preventive measures, let alone a full dietary intake and troubleshooting and recommendations and things like that. And then also, sort of diving deeper into other reasons things might be going on: sleep, exercise. I mean, there's so many different lifestyle changes and things that can affect our heart health, blood pressure, cholesterol, all of these things. And we're just not able to get that all done in the traditional medical model, which is just really sad.
It is. In preparation for this interview, I read Dean Ornish's Unbook, Undo It. And I don't think I'm ever going to approach or see life the same again. But may I ask you, do you feel that simple lifestyle changes can be powerful in, in reversing and preventing coronary artery disease?
I absolutely do. So, the estimates are that about 80% of coronary artery disease is preventable. What that means is that while genetics and things like age and things that we cannot change are important contributors to our heart health, or, our whole body health, they, in many cases, are not the most important factor. And actually, it's quite empowering when you sort of turn around and view it as the fact that that many of us, even those of us with strong family histories, do have a potential ability to prevent heart disease. And so I think that's why it really behooves us to get this information out there about what are these changes that we can be making to prevent heart disease.
Yeah, and isn't the truth when someone says, "Oh, their genes may be bad," that's a predisposition. That's not a fate. And I
Right.
think Yeah, and I think with lifestyle changes, you can really kind of put the control back in your court, or the ball back in your court.
Exactly. No, I think that's an excellent analogy. Yeah, it's one of those things that I certainly have lots of patients that will come to me, and they are, say they're in their 40s and their father had a heart attack at 50, and they're really almost. Feel like that is their destiny or their fate. And while it's true, again, I don't want to downplay the fact that genetics are important. We need to pay attention to them. And there are some sort of genetic cholesterol disorders that dramatically increase our risk from a young age. And so it's important to identify those and work on those from a young age as much as possible. So there's things like that that are quite important. But all of that being said, we do have data that shows us that even in people with a strong family history of heart disease, there was a really interesting study that looked at groups of people that had a strong family history and a high what's called polygenetic risk score. So, meaning looking at their genes, they would have been they were identified as high risk for having a heart attack based on their genes. And when they divided them into groups based on their lifestyle habits, it showed that those who adhered to a healthy lifestyle, exercise, maintaining a normal body weight, eating lots of fruits and vegetables and plants, actually had almost a 50% reduction in terms of their risk of heart disease. So there is that strong relationship between genes and environment, and we can influence the expression of those genes by what we do in our life.
I love that because even in I mean, there's some thought that with basically all the cancers, you really need the right environment, the right microenvironment, which is inflammation and stress.
Yeah, so I think we're really on the cusp of really still fully understanding how that complex interplay occurs, and it's going to obviously take a long time to fully sort out. But there's no doubt in my mind that that relationship exists, and while we can't prevent everything, we can prevent a lot of things. And I love being able to deliver that message to my patients. Yes, we need to remain vigilant. We need to check all of these things, but there's lots of things that you can do in your daily life to prevent having that same fate.
Yeah, exactly, like, controlling that chronic inflammation, that does not have to be your environment. And
Absolutely.
I thought it was really interesting because Dean Ornish also writes, and he to support your point as well, an unhealthy diet, especially high in animal protein, fat, and refined carbs, a sedentary lifestyle, chronic emotional stress, and social isolation each increase chronic inflammation, whereas a healthy diet with moderate exercise, stress management, and love and intimacy each decrease inflammation.
Yeah, that's right. And I love that also Dr. Ornish does, and it's always been sort of a large pillar of his program. Healthy diet gets a lot of press, as it should. It's a really, really important modulator. But I do think we've long forgotten to discuss those other components that he discusses, which is the importance of community, sleep, stress, all of those other factors that we're really increasingly recognizing as major risk factors for coronary artery disease.
I love that because I think in our society, like sometimes we try to find that one answer, that one key as like the major factor, but in actuality, it's kind of like the orchestra, the medley, the interaction of multiple key factors. And I think focusing on diet is important, but also it's the other factors as well, like stress, moving more, and feeling love and connection.
Absolutely. And it can feel overwhelming too, because you're like, oh my gosh, I have to do all of these things. There's all these things to do. So when I'm working with my patients, we do typically pick one thing and kind of focus there and try to kind of take small baby steps to lead to sustainable change. So I also don't want people to feel overwhelmed that, oh my goodness, if I not all of these things are perfect, I'm going to get heart disease. But it is important to recognize that there's other little things to do. And so maybe you're not ready to make whole scale changes in your diet, but you can fit in 10 minutes of meditation before you go to bed. Okay, let's start there.
It's ultimately the mindset that needs to change, like all of our mindset. Yeah.
Absolutely.
And I think there's so much scientific evidence for lifestyle changes. With like the Mutual of Omaha project, they found that 80% of people who needed bypass surgery or stent were able to avoid bypass by making profound life changes. Why do you think that, if there's so much evidence for lifestyle changes with coronary artery disease and many chronic illnesses, that, like, more doctors or healthcare systems are not implementing this in their care?
Yeah, so that's a great question. And I think it goes back to a lot of it goes back to what we were discussing in the beginning, which is how our system is set up. Lifestyle changes, writing a prescription, while it's a misconception that, doctors are in the pockets of pharmacy and whatever else. No, it's really just a function of the fact that, one, not all patients are ready to make these major changes. It requires a lot of dedication and time and some guidance, and unfortunately most medical providers either one don't have the education or the knowledge, and two just simply do not have the time to discuss these things, problem solve, troubleshoot, and really help them along the way. And so unfortunately the default does become, writing a prescription, which is that much quicker and easier for the provider.
Waiting for
And
the problem to happen, right?
Right, exactly, as opposed to kind of really starting from the beginning. And so I think it will require a really different model of care to be able to fully address these problems. I mean, so in my practice, for instance, it is not an insurance based practice, and I'm able to spend then the 60 plus minutes with my patients to really get into all of the weeds with them about all of these things. And then, it's a sort of a conversation. Okay, where do we want to start? What are we going to do now? And you kind of create that plan together. But that takes a lot of time. It just does. And then I think Secondly, as I alluded to, education is another big one. I think as you probably can attest to as well, we learn a ton in medical school. We learn a ton in training, residency, and fellowship. But historically, we focus on treating people once they're really ill, and that's complex and complicated and hard work, and it requires a lot of attention. And so, unfortunately, that's where the bulk of our education goes. I actually did a survey as part of my fellowship research project, asking questions of internal medicine physician attendings as well as residents, and then cardiology fellows and attendings, asking them about different nutritional questions and their comfort level, and their knowledge isn't quite as bad as they perceive it to be, but they don't feel confident in sort of giving that guidance, and nor do they feel like they have the time, and they almost all uniformly said they really wished that they could have more confidence in delivering this guidance and having the time. And then I think thirdly, it really does need to be a team-based approach. So I think incorporating more registered dietitians and other knowledgeable providers into the care team is critical. And unfortunately, those are just not supported as well. And just it's becoming, I think, a little bit more common, but it's not common enough. And so I think being able to kind of use a team-based approach, it could be quite helpful for patients as well.
I love that, and you bring up some really key points. I think the truth is in our education as doctors, our education with for like nutrition and exercise is really minimal to nothing. I think we only find out later in our lives if we didn't find out like at that moment. And the other,
100%.
yeah, and I think that's why we feel uncomfortable. And then the other issue is that we don't have time to talk about it. What do you feel are the motivating factors for your patients to actually make the lifestyle changes? Is it the social connection that you can provide for them?
Yeah, I think that it people seek me out for different reasons. I think that within the cardiology community, even though our guidelines clearly state that except in very specific circumstances, lifestyle changes are the number one thing that should be done for high blood pressure or high cholesterol, prior or pre-diabetes and things like that prior to instituting medications. And they really spell out, what to do. It's again going back to kind of knowledge and time and things like that. It doesn't end up being within the as common of a thing. And so, unfortunately, a lot of my patients come to me saying that their doctor told them their cholesterol was high and to eat healthier. And that was kind of the extent of it. And so,
And what does that mean? Yeah.
right, I'm usually like, okay, I get that. And, most patients have a sense of what healthier means, but they really need someone to work with them to create that plan and figure out what that is. And then I also do a lot of sort of deeper dive risk stratification, which I think is helpful for a lot of patients who are motivated to make changes. And because of, say, family history, a lot of providers people will come to me saying, I was told to just like lead a good lifestyle because my dad had a heart attack at 50, but like that's not good enough for me. I want to really a deep dive into my personal risk and what should I specifically be doing to modify my risk. And so, looking at different inflammation, as you were talking about, even now people still don't, even though it's in our guidelines as a risk modifying feature, people don't check that, or LP little a, or there's all these other things that can modify one's risk. So I do a deep dive into sort of those other things and then create kind of a more personalized plan, which is what people are really craving. It's 2021. It's time, it's 2021. It's time to like, really give people more personalized guidance as opposed to generalized information that they can look up on Google.
Yeah. I think with like 2021, there is so much information out there. But sometimes when there's so much information, it could be like really overwhelming. And in the end, there's like no information. But I think the real fundamental way is really to be there with that person to go through it slowly or at their own pace and, discuss it.
And that's another excellent point. I think that people certainly get overwhelmed with all of the information and misinformation out there. If you at this day and age, if you say it loud enough and say it enough times, it suddenly becomes true. So people get really confused. Is keto really healthy or unhealthy? I don't even know anymore. And so there's a lot of agendas out there and things like that. And so I think that's the other thing patients appreciate coming to a trusted source of information. And so, as physicians, it really behooves us to make sure we understand this stuff because your patients are going to come with you to you with questions about this stuff. And so you need to know about keto. What does the science show? Because we do have some science. You need to know about, calcium supplements or fish oil supplements because your patients are going to want to know. And so I think it's really important that us as physicians make sure that we can become that trusted source. And if we haven't learned it in residency or fellowship, then not that we all have tons of time, but it is important that we do some self study and dive into the literature a little bit and see what it says.
Or really to live it, because how much more can we help our patients if we actually live it and know it? Like, and actually to know what a healthy lifestyle is. And I feel like in the limited time that there is in the primary care setting, I feel like your clinical setting seems really ideal. The fact that you have time to talk with your patients. Because I think in corporate medicine, the truth is it's almost like fear-based. And fear-based information doesn't really go too far for, like, productive change.
Exactly. So there's lots of data on sort of what's the most effective forms of behavior change. And it's absolutely not, that's why like the commercials of the lung cancer smokers, like they don't actually work well because fear based advertising or information just doesn't end up being effective in the long term. It's all about kind of meeting patients where they're at and creating things called SMART goals, which are really small, achievable goals that are very specific and are created together with the provider and the patient that are time specific, not just I'm going to start eating healthier because that doesn't do anyone any good. It's I'm going to, instead of eating my egg McMuffin in the mornings, which I do every morning, I'm going to switch it to oatmeal 3 times a week with flaxseed cheese, that kind of thing. Very specific. And I'm going to do that for the next 3 weeks until I next see Dr. Harkin next. And then we work on the next thing. So creating those small, like achievable goals for sustainable change works much better than just saying you're going to have a heart attack if you don't start eating healthy.
I know, and then go into the land of denial, right?
Exactly, exactly. Well, and it's really abstract, right? And that's the other thing that I think a lot of this sort of more personalized guidance gives people is, again, most people know, generally kind of what's healthy or what's not healthy, and generally that eating too much processed foods is not good for them, and generally that they could end up with heart disease because of it. But it's a totally different thing to really get more granular with people and kind of specifically say, this is your specific cholesterol level. This is what happens if it stays this high over time. This is what we're seeing your inflammation or your glucose numbers or your coronary artery calcification score. Look, there's a little bit of plaque already in your arteries. That kind of information is really helpful to people to sort of see, no longer to take it from the abstract form and really bring it towards the sort of personalized, oh, like this is what's happening now, let's make some changes.
Yeah, and sometimes I wonder with our lives being so busy in 2021 and the age of technology, maybe that's not a good thing because we go out for, like, the reachable, like, processed foods which are readily available, and I think we really need to stop and think, like, maybe that really is not healthy, you know?
Yeah, I think the convenience foods right now are one of our biggest threats to our health, certainly. And I think sort of and that's what I was sort of referring to with kind of public health measures in terms of what we're supporting and subsidizing. And it's definitely something that as a society we need to make sure that we're prioritizing. the healthful foods like fruits and vegetables and whole grains, why aren't those subsidized? As opposed to the things that then go into just like our processed foods. Not to say that that none of those can be helpful or anything like that, but unfortunately they make up the bulk of our diet in America. And we really need to sort of as a community work together to figure out how we can reprioritize things and make those types of foods more accessible.
Love that. And can I ask you, considering the fact that the American diet is really high in animal protein, how bad is animal protein for us?
Yeah. So, I think we've got a wealth of data that at this point, large quantities of animal protein are not good for our heart health. And that comes down to lots of different factors that are well established, things like saturated fat, as well as sort of things that we're learning more and more about that may also be contributing heme iron, TMAO, all these other compounds that are also in meat or formed in our bodies once we consume them, that may lead to adverse outcomes. And so it's not to say, so we definitely have a wealth of data that says that we should all be consuming less of them. I certainly work with my patients where they're at. I think that a plant predominant or plant-based diet is a reasonable approach. And so I think there's many ways to go about eating that. But the bulk of our diet really should be fruits, vegetables, whole grains, beans, nuts, and seeds.
I was really shocked to also read like a single meal high in animal protein and fat can significantly decrease like the blood flow to like the heart and the brain. I mean, that's shocking.
Yeah, we've definitely done so. They've done some vasoreactive type studies where they look at how the blood vessel reacts to ingestion of these foods, and it's really true that in the short term we do see some vasoconstriction and inflammation, and it's actually I have a true story with my husband who actually is not plant based. He's I guess a flexitarian at this point, if you will, and we went for a run together, and it was he had had kind of a big fattier meal like 2 hours prior, 1 hour prior maybe, and he was just like, "I feel like I just can't like get enough blood to my body, like I can't move." It
Mhm.
was just completely anecdote and totally ridiculous, but yeah, we do definitely see kind of those shorter term effects as well, and more mechanistic reasons as to why some of these foods can be less helpful.
Yeah, that's a really great example that you bring up because even like I guess like high level athletes are, aren't they approaching more of like a plant-based whole foods kind of like diet regimen as well to improve performance?
Many are, yeah. So there's a lot of interesting performance sort of enhancement data that's coming out about sort of more plant based and plant predominant diets. And certainly there's a myth in our community at large that you can't get enough protein from plants alone, and so it's was typically previously thought to be a poor choice for athletes, particularly the ones that required a lot of muscle hypertrophy or strength. There's great examples of that at this point. Arnold Schwarzenegger and all these other guys who are completely plant based and have certainly have the physique that one would say is has plenty of muscle. And then there's endurance athletes too, cyclists and things like that. So I think just like any diet, you have to be mindful of how you are putting it together to make sure you're meeting all of your nutritional needs. But that's not unique to plant based eating. All of us need to be paying a little bit more attention to. I'm willing to bet that many omnivores, while they're probably getting adequate numbers of protein, they're probably not getting enough of some of the other vitamins, minerals, and micronutrients that are required as well.
Interesting. I was like really, really shocked to read that 80% of like the antibiotics that are produced go to our animals. Like, how sick is that? And
Yeah,
what are we
yeah.
ingesting then?
Yeah. So that's the other concern about sort of what we're kind of animal agriculture as a whole, right? So not only are there environmental concerns, and obviously animal welfare concerns, but then also things like antibiotic usage, which we as a community right now we're focused on this current pandemic, but the infectious disease community at large has been long focused on drug resistant bacteria, and that's unfortunately largely potentially a result of this usage within livestock. And because of the conditions that they are kept in, it's sort of ripe for infectious disease, unfortunately, close quarters, feces, and things like that. And so they're prophylactically given antibiotics. And so as a result, much of the antibiotic usage is in these populations as opposed to humans. And so I think if they're in terms of infectious disease concerns from drug resistant bacteria, that would certainly be one of them.
Yeah, and I mean, MDROs are rising,
Absolutely,
like resistant
absolutely.
organisms, yeah.
Yeah, yeah, absolutely.
Can I ask you, I was kind of wondering about this. So if animal protein is kind of not the best, how is wild fish?
Yeah, so I think that's a really common question that comes up. So setting aside sort of the environmental impacts, which are real, our oceans are definitely being um, uh, fished quite a bit. If you look at some of these different epidemiologic studies and observational studies, looking at the types of protein people consume, in general, the fish does come out as improved when compared to some of the other kind of red meat, certainly poultry, things like that. So, in my patients who do want to continue to consume animal products, fish is probably one of the ones that we do keep in, but just being mindful of the fact that there are sort of environmental concerns and things like that. And that's included in kind of more of a Mediterranean style plant predominant
Mhm.
eating pattern.
And how is like organic raised meats? Is there any difference?
Yeah, so I think the organic meat question is an interesting one. I think a lot of the concerns that I have as a cardiologist about meat, in terms of saturated fat and all of those things, um, organic or not doesn't change things, in terms of potentially how the animal's been treated, potentially less antibiotics you're consuming. Some of those other concerns may be better or improved, but from a heart health standpoint, I don't think that they're necessarily much better, and I'd rather focus on just switching to plant-based sources of protein on occasion. And again, it definitely does not have to be an all or nothing. I have a lot of people who come to me wanting to make kind of smaller changes, and we work on those together. And I often find that it's easier to kind of pick small things to swap out, also kind of crowding out kind of some of the meat sources, like flipping the protein. So instead of a massive steak, you have a much smaller piece of protein and animal protein, and then a lot of fruits and vegetables. So it becomes less of the sort of main dish entree and kind of a side. It's more of a sideshow.
And I mean, considering the fact that I am a meat eater, and I think really reading Undo It is going to change things for me. But isn't the truth? I'm sorry, I lost my train of thought there. um,
That's okay.
actually, let me go on to another question. Do you feel that lifestyle medicine is better than angioplasties and stents in treating patients with stable coronary artery disease?
So that's a great question. So just for your listeners to make sure we're defining things appropriately. So stable coronary artery disease means that individuals have blockages in their arteries, but their symptoms are not new or crescendoing, meaning their disease isn't sending out red flags that they're potentially unstable in some way. So that's very different Yeah, people who are having heart attacks, people who are having unstable coronary disease. The science clearly shows that we need to acutely open up that artery so that it doesn't cause massive damage to the heart with a stent. So, setting that aside and focusing just on people who have run of the mill stable disease, nothing that's kind of concerning me acutely, we actually have a lot of great data at this point that, so the ischemia trial, and more historically the courage trial, where we randomized groups of patients with stable coronary disease to receive either interventions like stents or bypass surgeries, or they receive a kind of standard goal directed medical therapy along with lifestyle changes. And see sort of who performs better. And then more recently in the ischemia study, we actually looked at patients who had really decent amounts of, we called it moderate amounts, but as a cardiologist looking at these studies, you're like, okay, that's a lot of ischemia, meaning that these weren't just like people who had like a tiny little ditzel of a plaque. These were people who had large territories, moderate sized territories at risk, and no left main disease of note. That's really important. So the patients that have a blockage in the very top part of their main artery, those patients were excluded, but everybody else was included. And the patients who had medications and lifestyle actually did just as well as the patients who had an intervention. There's some subtle differences in timing and things like that, but overall, they performed well. So I think certainly the medical community is at large is moving away from this idea that you need to put stents in blockages when you see them, um, uh, for sort of improving a patient's chance of survival. So it's more about kind of quality of life. So if a patient isn't responding to medications and lifestyle and still has limiting symptoms, then that's a good reason to put a stent in and open it up. But in terms of just doing it to because you think it's going to make them live longer, is unnecessary, except in certain situations, obviously. And I think that that's really powerful and really important difference. And that really kind of leads me into the point that coronary artery disease is a systemic disease by and large, right? So just because we see a big blockage in one of the arteries, um, there's likely lots of little blockages all over and subclinical disease. And there's probably blockages or subclinical disease in other arteries of the body. And so it's really important that we address the root cause and not just kind of put a band-aid on that one blockage. Again, this is there's certain situations in which we need to do that to save portions of the heart muscle. But for kind of the routine stable people, we can really use these medications and lifestyle to improve symptoms and to increase their chance of survival.
Yeah, because isn't it, like, scientifically proven that lifestyle changes can really reverse and even continue to prevent coronary artery disease or heart disease?
So
Yeah.
when you say reverse, it's a little bit controversial in the sense that when people are referring to reversal of heart disease, many times they're saying that they like can see the plaque go away. We don't have enough data at this point in large enough populations that's randomized to say that that definitively occurs. What we do have is data that shows in, say, something like PreDiMed. Whereas if you randomize people to a good heart healthy diet, you can reduce their risk of having a heart attack or stroke or death from heart disease by, large percent, 30, 40%, right? So, and that's what matters ultimately. As a cardiologist, I don't care if your plaque is 20% or 30%. As long as it doesn't do anything, then we're good, right? So more importantly to me is outcome data in terms of, are these people having less heart attacks, less strokes, less likely to die from their heart disease? And the answer is yes.
Do you feel like, patients who have had heart attacks or stents placed, are they getting enough, like, adequate handholding after to kind of help with the lifestyle changes?
That's a really great question. And I think that that is where, as a community, we definitely need to do better. So, patients who've had heart attacks, have stents, have had bypass surgery, they are among our highest risk patients for having a recurrent event. And it certainly is on us to make sure that they're feeling supported in their journeys. And so, it varies widely, I think, from hospital to hospital. I have many patients who feel very supported and get plugged into sort of a heart health team that includes an RD, includes rehab. Rehab's a great one where people really feel like they get a decent amount of nutritional information and a supervised exercise program. That's huge. And again, data supports that that is life saving. And reduces risks of events. So I think it just varies widely. And then other patients who were never told about cardiac rehab and just were told to take their medications and nutrition wasn't addressed at all. So we definitely need to do better about sort of standardizing that program about once a patient's had an event, what needs to happen.
Yeah, because I think the ultimate truth isn't the ultimate truth stents don't prevent bypass surgery, like, we have to do the work to prevent getting to that point.
Yeah, exactly, and that's sort of where things are going. I mean, certainly, stents were a major advancement when it comes to abruptly needing to open up an artery, and so they are life saving in that setting. And I don't want to downplay that at all. But I think when you're talking about trying to prevent further events, really focusing on uh, the medications, as well as this lifestyle changes that are incredibly important to help us bring down our cholesterol, help us bring down our blood pressure, help us bring down our inflammation. And because again, it's a systemic issue. And so it's not necessarily going to be that bigger blockage that you see. It could be a different blockage. And so
Mhm.
focusing on things like medications and lifestyle that help bring down all these things systemically, it can is really, really effective.
I thought it was also interesting that, women who reduce their dietary fat intake to only 20% or 33 grams of fat per day decrease their breast cancer recurrence by 42% after 5 years. It's really remarkable.
Yeah, it's kind of cool that, and this is reflective in sort of guidelines from different
Mhm.
organizations, the Cancer Society, all these different organizations. It's a really similar diet that comes out and that emerges from the literature as this plant predominant or plant based diets. And so, it's really pretty cool that the same diet prevents heart disease, that reduces your risk of cancer, that reduces your risk of dementia and Alzheimer's. So and a lot of that comes down to sort of similar kind of pathologic beginnings, and so it's great that all of these lifestyle changes that we're making are good for our hearts and our brains and the rest of our organs.
Do you think fat is inflammatory?
Like
Like high
adipose,
fat
like
diet?
actually adipose. Oh, high fat
No,
diet.
high fat diet, yeah.
I was like, adipose tissue on your body? Actually, yes, no. So yeah, I think that it depends. I think it's really dependent on where it comes from. So I think that certainly plant-based diets, there's a lot of data showing reduced inflammation, and a lot of plants are really good at reducing inflammation. They've got tons of antioxidants and all of this good stuff. And I think that our body definitely responds differently to saturated fat versus monounsaturated, polyunsaturated. We could do a whole nother podcast about this if you wanted to. But yeah, I tend to not restrict poly and monounsaturated predominant foods in my patients, things like avocados and nuts and seeds and things like that. As it's those have really been shown that when you swap those in for saturated fat like butter and animal products and things like that, you get reductions in cardiovascular endpoints. And fat, kind of like carbs, is sort of an all-encompassing term, and it different fats or different carbs within a group behave differently.
Mhm, and it's the refined carbs that are really bad, like sugar, white rice, white flour kind of thing, right?
Right, exactly. So sugar in whole fruits that come with all of the vitamins and minerals and fiber. In every, I think, epidemiologic study that's ever been looked at, people that consume, good quantities of fruit do really, really well in terms of all cause mortality and lots of other events. So carbs are very different depending on where they're coming from. So it's really the processed carbs that have been stripped typically of their fiber and a lot of their minerals and nutrients that are not so good for us.
I'm kind of like dying to ask you this question, but I'm not sure. Let's see. What do you think of a low carb, high protein diet? And I mean high animal protein diet.
Yeah, so I do have a lot of patients that so like a kind of a keto style diet, or I guess less
Or
keto because more
Atkins,
protein
yeah,
or
or
yeah.
paleo.
Right. So I do have patients who come to me on those diets. We have a decent amount of head-to-head literature at this point showing that for the most part, uh, ketogenic style diets, high saturated fat style diets are not good for our health. Again, they tend to be because they're high in animal products, they tend to have a lot of saturated fat and are fairly devoid in fiber and a lot of the other like antioxidants and minerals and things that we need. So for most, and I know a lot of my patients will come to me on that because they're wanting to use it for weight loss. So obviously doing it for a couple of months in the grand scheme of your whole life at the age of 30 or something, is very different than someone who's pursuing this as a long-term strategy throughout their whole life who has risk factors for heart disease. So again, I think this is where it comes down to an individualized approach. But for the general population, I definitely would not advise them to pursue that strategy as like a long-term nutritional pattern. There are ways that if someone is really, really adamant about pursuing that type of a strategy, there are ways to make it slightly more healthful, which is less animal products and more plant based fats and proteins. So, really focusing on from the fats, as I said, the avocados and the nuts and seeds like that. If you're trying to do a really high protein, it would be tough to do that without kind of a lot of plant protein powders and things like that. Um, so there's ways to tweak it, but then it does become quite restrictive. Um, so for me, I try to work with my patients on kind of getting less animal products and more of the plant-based products, and then also trying to. I think the big takeaways from that diet is cutting out all the processed stuff.
Mhm.
And that I think is why a lot of people, it's a lot of water weight, but then also it's the restriction of all these processed and packaged foods that leads to a lot of weight loss. And so I think you can take that sort of leanings and lessons and apply that, and keep that part to it, but then slowly reintroduce some of the more healthful plant-based foods. And a lot of my patients have had a lot of success with that.
I thought it was kind of funny because in the book Undo It, Dean Ornish describes those diets as mortgaging your health for weight loss.
That's actually an interesting way of putting it. And again, we don't have
Yeah.
long-term randomized controlled trials, but we have a lot of observational literature and some short-term randomized controlled trials. And yes, all signs point towards it can reduce result in some weight loss. Again, a lot of that's water weight. Um, but it is not kind of a good long-term strategy for all the other reasons we've talked about. So I think there's ways to kind of once people have done it for say a couple of weeks or a couple of months and maybe lost some weight and they're kind of happy with the way they are, there's ways to kind of reintroduce and tweak it so that it becomes a more healthful, sustainable
Mhm.
sort of nutritional pattern going forward.
Yeah, and people may not know this. I mean, they think with like the idea of a low carb, high fat, high protein diet, that that their insulin, because there's those minimum sugar intake, that their insulin may not be challenged. But the truth is, fat can also promote increased insulin, right?
Yeah, so there's actually a lot of really great data out there about plant-based and plant predominant diets. leading to reversal of diabetes and insulin resistance and all of these things. And so there's a lot of misinformation that it's just the sugar that's the problem. And so, we see great results in patients who cut out the refined carbs, but keep in sort of the whole foods that have sugar in them, like fruits and things like that. And again, it can be patient to patient dependent. That's where things like CGM monitors can be really helpful in people with diabetes or pre-diabetes, which is kind of measuring continuously their glucose and figuring out individually what affects what types of foods affect some patients more than others. So that's again where kind of a more personalized approach comes in. But on a population-wide basis, um, you know. Uh, Things that are quote unquote higher in sugar, like whole grains and fruits, can lead to diabetes reversal.
Wonderful. And I thought this was like really staggering. There's a study over 6,000 people ages from 50 to 65, who reported eating diets high in animal protein. And I think this pretty much sums it up. So those who reported eating a diet high in animal protein, there's a 75% increase in overall mortality, 400% increase in cancer deaths, 500% increase in type 2 diabetes during the following 18 years. It's shocking.
So yeah, so that's one of many randomized or one of many observational studies that we do have that does show that there's these associations between people that eat large quantities of animal-based products and increased risk of death and heart disease and such. And so, I really do feel for people that are searching for ways to lose weight or do things that they think are good for their bodies. And it's quite appealing, right? The butter is back and like all these other sort of like um quick type fixes or things that we find delicious that are now supposedly good for us. It's really appealing. And people have, previously tried all other methods of trying to lose weight and haven't been successful. And so I do understand where sort of just trying something radically different sounds appealing. But I think that it's unfortunate because we have definitely enough data to show that in the long term, these aren't going to be the best choices for our bodies.
And it's really ultimately comes down to, I think, what kind of life do you imagine for yourself? I mean, having been a hospitalist at 80 or 90 years old, it can be really scary. And I think these are preventable illnesses, chronic, diseases. And if we can kind of be more better advocates for ourselves, I think the ball is in our court then. I
Yeah, no, absolutely. And there's ways to do, I mean, and the other thing I think that's such a perception is that plant based or plant forward or plant predominant eating is boring and you can't have the foods you want. But it's one, it's all about kind of making small changes and little substitutions. There's so many spices and garlic and delicious flavorings that you can use. And it doesn't have to be an all or nothing approach. Again, I have plenty of patients who are completely whole food plant based, no oil, no salt, and that works great for them. I have other patients who eat, 90% plants and a little bit of, meat every now and then. So and then some people that are in a completely different place in their journey, and so it's definitely not an all or nothing approach. And I don't want people walking away from this thinking that, well, I'm never going to go all plant based. So what's the point? It's all anyone can eat more fruits, vegetables, whole grains, beans, nuts, and seeds, not just plant based eaters. And I think that's the first important step, and figuring out kind of where that works for you and your body and your family and your journey.
and may I ask you, how bad is stress for us?
Stress. Yeah. So the literature there is interesting. Again, we don't have any randomized controlled trials here, which is kind of the gold standard of research, but we do have plenty of observational data that chronic stress, for a long time, the literature really focused on sort of short-term stress events like, something really traumatic happening and PTSD and something like that. And so we recognize that those events, adverse childhood outcome, things like that, we recognize that some of these short bursts of stress were bad for us. But the literature does suggest that sort of chronic stress, whether it's financial or relationship, or any other cause, does people that have chronic stress for long periods of time do have increased risk of heart disease. And there's mechanistic data to suggest that there's direct causes of stress. It increases our fight or flight response, so our levels of catecholamines and are up a long period of time. So you're always with adrenaline, and what those substances do in our body is increase our blood pressure, increase our heart rate. We have more cortisol, which leads to inflammation, and that's our stress response. So physiologically, there's reasons as to why it might lead to increased risk of heart disease, but then also sort of indirectly when we're stressed out, and probably anyone listening can kind of say that this probably has happened to them as well. I know personally, when you're stressed out, you're just less likely to make healthful choices. It's harder to do so. And you're seeking kind of the comfort foods, or you're just don't feel like going for a run or whatever it is. And so it's probably a combination of both of those things, that when we're stressed out, both sort of indirect and direct reasons as to why we see increased risk of heart disease.
Oh my gosh, thank you so much, Dr. Hargan. You're such a wealth of knowledge. It was really enjoyable to speak with you today.
I had such a good time chatting with you, and I hope we do it again soon.
Thanks for watching Lost or Found. Are you looking for a unique perspective to help you gain insight into your health and well-being? Schedule a virtual wellness visit with Dr. Michelle Choi by going to our website, drlostorfound.com, to schedule an appointment. Please subscribe and follow Dr. Michelle Choi on Instagram, Facebook, Twitter, and YouTube.